Okay, good morning, everybody. It's another beautiful central Missouri day, sunny, not too hot. So today we're going to talk about away we go. Those of you old as me will know what that comes from. And then I'm not really, but sponsored by Booches this morning in Columbia, 2 blocks from the University of Missouri. Best cheeseburgers. Hey, Eileen. Okay, so we're going to talk about pregnenolone. So we talked, this is Wednesday, on DHEA, and I mentioned that I call that the mother of all hormones because of that hormone cascade that I showed you Wednesday before class. So pregnenolone was the direct descendant from cholesterol. It's made in the brain, it's made in the gonads, it's made in the adrenal gland. And since it's upline from DHEA, I call it the grandmother of all hormones. And looking around, you can see it called the mother, the grandmother. DHEA is the mother, but they're interrelated with each other and pretty closely related, based on that hormone cascade that I showed you, all that chemistry. So the little picture for this one is a three-dimensional look, sort of pregnenolone, and then that cholesterol metabolism. And so if you notice, DHEA is usually associated with sex steroid conversion. Okay, so pregnenolone not so much. And as a matter of fact, when you look at the history of pregnenolone, some people use pregnenolone. I can think of several doctors that recommend that for improving progesterone. But the conversion has to go through DHEA, not completely. And the conversion of pregnenolone to DHEA is about 16%. So it's not quite as good as maybe people would think. But there are plenty of people take pregnenolone for the conversion factors that pregnenolone does, as well as DHEA. And specifically, most of the time they're trying to get a handle on their adrenal fatigue. That does not have an AMA recognized diagnostic code. Most people think there's no such thing as adrenal fatigue. I don't know if you can call it that or what, but I do know that people do have fatigue and lethargy if their DHEA levels or DHEAS levels are low. You can measure pregnenolone in a blood test, not quite as easy or as inexpensive as doing a DHEAS level. Although I was looking at somebody's bill from Quest from last fall, and a retail price on DHEAS level was $213. So without insurance, the best way to get these labs measured are as direct access, because I believe a DHEAS level from direct access labs is probably 10 times less than that, usually around $32, it seems like. Okay, so what is pregnenolone? So if you look at that cascade that I put up, it is directly from cholesterol. And like I said, it's made in neurons, it's made in the brain. The gonads, it's made in the adrenal gland. And again, it's the grandmother of all hormones, depending on who you read. Okay, it's used to create a whole bunch of other hormones. In fact, the adrenal gland produces about 150 hormones, theoretically, all of which can be made from pregnenolone. So including testosterone, cortisol, progesterone, estrogen, DHEA, and others. DHEA, again, is converted better to the sex steroids, testosterone, progesterone, estrogen, than pregnenolone is. Okay, and we talked last night in our Art of Floundering podcast Wellness Week with the panel. We talked about hormone balance. That was the first part of what we talked about. So what you want to do, and since this is the top of the adrenal hormone cascade, it's important as far as balance. And like any hormone or any supplement, you can take too much, you can have too little. So it's important to monitor. So have somebody, a physician, if they're into that, into that kind of hormone supplementation, or a health coach like me that works with physicians to try to keep you balanced. So it's a natural hormone. There is no way to patent pregnenolone, just like there's no way to patent DHEA. For some reason, progesterone has a patent, but if you use it topically, it's over the counter. Estriol cannot be patented, but the only way to get it is to have a compounding pharmacist put it in hormone replacement. Estradiol and estrone both have patents, even though they're natural hormones. And then testosterone, of course, is a controlled substance. It's category 3 for the DEA, even though it's a natural hormone. So most of the testosterone is manipulated. So there's some synthetic variations that pharmaceutical industry people, researchers, put so that they can patent certain things, even though they're natural. So if you're taking a pharmaceutical grade, I guess, supplement, you're not really taking the natural variation. That takes a compounding pharmacist. Okay, so that way, if you synthetically alter progesterone, you get Provera by adding a medroxyprogesterone acetate group to that. So what you're taking is not progesterone at all. It's the synthetic variant that's been manipulated. So of course, when you alter a natural substance, your body doesn't really recognize that. Like when I tell people about eating, you've heard this before. If you eat a Twinkie, your body doesn't know what that is. If I give you a carrot, your body knows what that is. So natural substances are recognized by your body. Things that have been altered do not. Okay, so 1940s, about when pregnenolone was basically looked at, I guess, by researchers. And what they found was people under stress have lower pregnenolone levels, and if you give them pregnenolone, which is well tolerated, we usually use about 25 milligrams a day. Back in the 40s, they were giving 200 to 400 milligrams a day with no side effects. Of course, because your body knows what to do with excess pregnenolone, right? So they found that people that were under stress could reverse their fatigue and reverse the loss of energy that occurs with stress and anxiety. So anybody that's undergone stress, which is like the definition of American these days, knows what the fatigue and loss of energy and lethargy that comes from being anxious and stressed out. So it's closely related to cortisol, since it's in that same cascade. And pregnenolone tends to reduce the production of cortisol, which is under excess production with people with anxiety and stress. So it's an easy way to relegate or regulate your own body's hormone balance, especially for people who are producing too much cortisol because they're under stress. Okay, so cortisol actually was looked at closer because it can be manipulated into cortisone and hydrocortisone and some of the other steroids for management of disease processes. But if you really just want to regulate your cortisol level, you just idealize the level of your pregnenolone. So what does it do? It improves energy, and we'll go through some of the different things that pregnenolone has been studied for. So we find that pregnenolone, from research, improves energy, vision, memory, clarity of thinking, well-being, and sometimes libido. Well, I think DHEA does that better. Of course, testosterone does it the best. So really, pregnenolone is considered a good brain supplement for those who experience brain fog. That is also not a diagnostic thing from the AMA, but anybody that has brain fog knows what I'm talking about. So the inability to remember simple things as you get older. Pregnenolone, interestingly, is not one of the hormones that decrease with age. It's everything below pregnenolone that decreases with age. So you typically don't lose your pregnenolone making capability. But if you're supplementing with it, it improves everything below it. So it can help balance out the things that are decreasing with age. So pregnenolone is a very effective and powerful memory booster. It is involved in neurotransmitter and synapse action. Okay, so I'm sitting here looking at a study that shows, let me get to it, Alzheimer's disease. Okay, so my generation, baby boomers, don't mind getting older, don't want to get Alzheimer's disease, don't want to feel old. So part of the series of these hormones is to tell you how simple really it is. You probably need guidance to balance all that out. And most of this stuff that we're talking about actually does improve Alzheimer's disease or potentially prevent the development of that in the first place. So Alzheimer's disease involves amyloid plaques, okay? They have beta amyloid proteins and neurofibrillar tangles. My Missouri accent, I trip over words, okay? Those are toxic, so they have a primary toxic action on cerebral neurons, and it's partially responsible for the degeneration of Alzheimer's disease, okay? So if you give, this is by research, pregnenolone reduces the production of beta amyloid proteins, and so you're raising the quantity and quality of the neurosteroids in the brain. Okay, so reduction or less action by pregnenolone appears to be involved in the degeneration of Alzheimer's disease based on the formation of beta amyloid plaques. Okay. Of course, this is an over-the-counter medication, supplements, not really a medication, it's a hormone, natural hormone. So there's not a whole lot of, placebo-controlled randomized double-blind studies because there's really no money in something you can't patent. But there are researchers that do stuff like this. So I usually find the basic bench research on this stuff. It's not done in clinical research, but it is done on bench research. Okay, what they haven't figured out from bench research is what it is, the mechanism of action that pregnenolone has on the reduction of formation of amyloid plaques in Alzheimer's disease. Okay, so there is an action of pregnenolone on the glutamate receptors and GABA receptors, and GABA is involved with Neurontin. So people take Neurontin for peripheral nerve pain or for seizure disorder would really have to kind of be careful with pregnenolone because it reduces some of the activity of GABA. Okay. The other thing it does in the brain seems to increase hippocampus neuron production by 55%. So really what you're doing is with pregnenolone, since it's involved in the central nervous system, you're creating new neurons. And in the hippocampus, that is how you seal your memory. And that's why it's used, it's felt to be very useful for people that are getting forgetful or having memory problems. So you're developing new neurons, which is how you learn, right? Unfortunately, if you have a stroke, if you lose your neurons, they can't replace themselves by mitosis, but you can continually form new neurons, and pregnenolone has something to do with that. They just can't figure out how. Okay, it also has a calming effect on the emotions. Okay, so brain cells can be injured by fatigue and stress, and pregnenolone can calm that. So it helps protect from the stress response of excess production of cortisol. So remember when I teach, I tell you what I'm going to tell you, then I tell you what I told you, right? So pregnenolone people, or balanced out pregnenolone people, seem to be resilient to stress, and they're able to confront challenges better, in their opinion, by using pregnenolone and having that monitored. Seems to be 100 times more effective for memory, pregnenolone, than any other steroid or steroid precursor. So this, the main reason for pregnenolone, when you look at the research, is to improve your cognitive brain function and form new memory synapses in your hippocampus so that you have a feeling of well-being. You don't get the fatigue that you get when you're stressed out. Okay, so it's a balanced thing. So your pregnenolone, if taken as a supplement, your body can read that and alter either up or down the other hormones downline from that in a natural way. Okay. Some women with perimenopause seem to react well to pregnenolone as far as decreases in hot flashes or premenstrual symptoms, probably from progesterone production, but I still argue that DHEA is better at producing progesterone. One of the ways that we use the progesterone, if you look at that cascade, progesterone can be turned to 17 alpha progesterone. We used that years ago. There was a paper, okay, so 2002, I don't know if that's years ago, kind of. 2002, the Society of Perinatal Physicians who do high-risk pregnancy published a study. So this was the first randomized double-blind study of using 17-hydroxyprogesterone caproate to decrease the onset of premature delivery. Okay, so if somebody had had a premature infant before, if we gave injections of 17-hydroxyprogesterone caproate, it reduced, I think, 57% chance of a further premature delivery. So we gave a shot every week. When that, so this is how the pharmaceutical industry works. That was a compounded hormone. You had to have I used to use a compounding pharmacy in Fort Smith, Arkansas. They would whip up 10 cc's for a patient. So we'd start about 18 weeks giving them 1 cc of 17-hydroxyprogesterone caproate through the 37th week. That cost about $50. When the Society of Perinatal Physicians paper came out, there was a company that put a patent on that, and all of a sudden 10 weeks of that hormone, which cost $50, became $30,000. So this is one of those times where the pharmaceutical industry got beat because the American College of Obstetricians Gynecologists threw a fit and they removed the FDA patent or whatever it is for that, so you can still get it as a compounded hormone. But it is like 4 steps down from pregnenolone. Nobody's ever done a pregnenolone study on premature labor. Probably wouldn't work. Okay, so the adrenal fatigue thing we talked about. Usually, pregnenolone level stays reasonable in early adrenal fatigue, and you can see that the adrenal fatigue mechanism has to do with a reduction of DHEAS levels. But as you have more adrenal fatigue, trying to convert more pregnenolone to DHEA, eventually your pregnenolone production goes down because you're favoring producing hormones such as cortisol to reverse fatigue and DHEA. Okay, so it can be paradoxical to take a supplement, and that's why you kind of need some help. Most people, I'm guessing, have never even heard of pregnenolone. I do know a physician in St. Louis that's used pregnenolone for at least 15 years. It's part of what he uses for his bioidentical hormone replacement. Okay, so one of the ways pregnenolone helps memory is by increasing neurogenesis, new neurons, by boosting acetylcholine levels. Okay, and so in France, they found out that pregnenolone can increase acetylcholine release by 50%. So that's how it's considered to be involved with neurotransmission through or as a neurotransmitter. Acetylcholine is a huge neurotransmitter, and if you can improve that by 50%, there's also some calcium channel effects of pregnenolone that we don't need to go into unless you want to take my class at State Fair on human physiology, and I'll teach you that entire thing. Okay, if you're under 50 and you're taking DHEA and pregnenolone, sometimes it's reasonable to take a week or two off per month. So if you're under 40, you probably don't really need DHEA or pregnenolone unless you have a doctor do your labs and you find out that you're in that really low range for your age. Remember, DHEA goes down by 5% every year at age 30. Okay. By 40, it's noticeable if you're low. Not everybody's low. And so usually people in their 40s, I tell them, take this 3 weeks of the month. And then in the 50s, or 2 weeks out of the month. In the 50s, usually take 3 weeks on, 1 week off, if that's all you're taking. If you're using a hormone compound, it's in there every day, and that's usually for people having perimenopausal symptoms, or those that are in menopause probably need that every day. But as a supplement, taking a little holiday, maybe 1 week out of the month is reasonable until you get into your 50s, and then probably once a day is a reasonable way to do it. Okay, so I told you about 400 milligrams back in the 40s for a month or two had no toxicity. There's no side effects. Typically 25 milligrams a day, if you're using it in a compound or even just as a supplement, is reasonable. You're not going to have side effects. 50 to 100 milligrams, short-term studies, no toxicity, any of that problem. So what else does it do? So I've been focusing on brains, right? Brains and stress and anxiety, blah, blah. So you get better cognition, you get better memory, okay? It improves mood. I'm looking at a study here on a randomized, double-blind, placebo-controlled trial of pregnenolone for bipolar depression. Works. So people with BPD, bipolar disorder, typically don't come in if they're manic. They come in if they're depressed. And so pregnenolone seems to relieve that depression. This one's a randomized one in people with bipolar disorder type 1 or 2. So easy way to potentially improve that depressive part. It's also been used, here, so I'm looking at a trial on cognitive function and symptoms related to schizophrenia. So pregnenolone, well tolerated, it's called the proof of concept trial, and actually reached statistical significance for reducing the negative symptoms of schizophrenia. Okay, so that's kind of cool. So once again, we're still on brains. So anxiety, depression, improvement of mood, balancing. We've talked about oxytocin doing all that. We've talked about DHEA doing all that. Now we've talked about pregnenolone. So there's 3 little options, only one of which requires a prescription, and that would be oxytocin. Okay, the other thing, there's a derivative called allopregnanolone that stimulates deep sleep. So for those of you that continue to have insomnia no matter what, and don't want to take some of those medications that make you sleep drive and sleep walk, I'm thinking of one in particular, and it's my mind is blocking it. Probably I need to take more. I take pregnenolone every day. Apparently, maybe I need more. I can't pull this out. It's the big sleep thing, the hypnotic for sleep, but it has a lot of side effects. So pregnenolone induces deep sleep. Okay, so it's ideal for people who have sleep disturbance or insomnia. Okay, so it increases the amount of time that a person spends in slow wave sleep. And that's usually the first third of the night when you sleep the deepest. And then the last third of the night is when you have REM sleep and have dreams, which is why when you wake up for just a brief amount of time, depending on how intense the dream is, you can remember it because you've been in REM sleep. Okay, how about this one? Weight loss. If it inhibits cortisol, which is involved in inflammatory response and insulin resistance and weight gain, because of its stress-reducing activity, weight loss may be an added benefit to balancing out all the adrenal steroids that come from pregnenolone, because cortisol increases abdominal fat girth and storage of fat. So if you reduce cortisol levels, you're naturally boosting testosterone, maybe, which helps increase your metabolism and lead to weight loss. So one of the questions on the Adams score from St. Louis University, it's called the androgen deficiency in the aging male. It's a 10-question yes or no deal that I give men that think they have testosterone deficiency. One of the questions is, have you gained weight in your lower abdomen? Okay. So only three. So if you give that score, or if you give that little test to men that are, older than 40, 50, if they answer three as yeses, almost every time they have a low normal or below normal testosterone level. And even if they're in the kind of, not even mid-range, I'll guess the lower 25th percentile, they're symptomatic. So they have symptomatic testosterone, maybe not deficiency, but suboptimal for them. And they gain weight. Women do the same thing. They get testosterone deficiency. Okay, so with all supplements, I'm not saying again that this will cure or treat anything. It's not an FDA-approved medication because the FDA doesn't regulate supplements. You got to find a good supplement company. So buying your supplements at Love's or Eagle Stop or a convenience store is probably not the way to do it. You've got to seek out somebody that knows how to get pharmaceutical grade supplements and have somebody guide you. That may not happen with a physician, but it'll happen with a health coach who has a background in functional medicine, and there's a bunch of us. So I keep hearing from health coaches all over the world, actually, that I just talked to a psychiatrist a couple of days ago who quit practicing medicine. Horrifying story for her. And I told her, I said, well, just become a health coach. You got a medical doctorate. So she and I have been chatting back and forth about what that means. And she doesn't know what that means. So I'm trying to teach her what she can do with her medical degree other than practice psychiatry. Okay, so just the things that I've told you in the last week and a half is stuff that she could help people with as a health coach based on her psychiatric background and all these brain things that these hormones really do play a role in. So that's the grandmother of all hormones. I'll put you up a link if you want to look at it a little bit more. Actually, I'll put you up a link that is pretty easy to read instead of something ridiculous like I usually read. And then a good supplement for pregnenolone. But again, most of the time, DHEA is an androgenic hormone. It's over the counter. You just got to know how much to take, and you know how much to take by guidance and having your labs done. You can do that without even going to a doctor. So, good to talk to you this morning. Have a great weekend. I'll see you Monday. I'll think something out for Monday. Think up something else. I think I know what I'm going to talk about Monday. Any of you that have heard of the MTHFR genetic stuff, I think I'm going to try to explain that on Monday. Some of you will know what that is. I know one person that's on here know exactly what that is. And I think what we'll do is talk about that and help you figure out whether or not you should have that tested. It does make a difference. And it makes a difference in brain function. And then we'll talk about pharmacogenetics coming up probably in the next week or so, about how you metabolize medications, etc., based on your DNA. So, pregnenolone, grandmother of all hormones. You all have a great weekend. Peace and health to you all. We had a great Art of Floundering podcast wellness week last night. We talked about addiction, we talked about hormones and hormone balance, and we talked about mental health and anxiety, and we talked about transgender treatments and how that can affect mental health and hormone balance and all that. But we keep them about an hour. Thursdays at 7. They're on YouTube, Art of Floundering podcast. Subscribe to that one because we're trying to get over 100. We didn't manage to get our own URL for YouTube, but the more people we have subscribed, the better. Okay, peace and health. We'll see you. Have a good day. Bye.